People sometimes think their person who's refusing is in denial and they're just being difficult and stubborn, when in reality, oftentimes, and it's really difficult to quantify exactly how often, but it's actually the disease in the brain, and or if they don't have, say, Alzheimer's disease, whatever's causing their cognitive impairment is affecting their ability to think clearly. And so that could lead to things like short-term memory issues, executive dysfunction, which is things like planning, multitasking, organizing. So even if you have a family member who's like, okay, yeah, maybe I'm I'm slipping a little. Okay, yeah, I'll get the evaluation. They may, if it's only up to them to go follow through with the doctor's recommendations, like to go, for example, get an MRI at the imaging center and go have a neuropsychological evaluation. I hear it all the time that person they forget, or, for some reason they don't get to those appointments. And from the earliest stages, it's really important that you as a family member you're keeping tabs on things, and it may have to be from afar to allow the person to essentially do them on their own if they're early on in their, they have mild symptoms, but it may be surprising to people how much they need to be aware of and be involved in what's going on right from the get-go. So other disease-related things that can happen, something called anosognosia. And so this is where there's little or no awareness or insight about the symptoms and the disease that's happening and how it's impacting the person's life. And this is due directly to the areas of the brain that are damaged by the disease. This was first described in 1914 by French neurologist Joseph Babinski, and it seemed that individuals who had damage to their right parietal lobe in their brain specifically would have this complete lack of awareness that they actually had any kind of symptoms. And so they would have left-sided weakness, and they would not realize it at all. There was no awareness of this, despite doing a neurologic exam and demonstrating right in front of them that their left side is weaker. And so this can happen with strokes, traumatic brain injuries, dementia, to name a few. And this concept is so valuable to keep in mind when you have a family member that you are trying to rationalize with them, and there's clear evidence right in front of everyone that obviously there's an issue and they're oblivious. And so keep in mind that this could be going on. And then impaired judgment. This can happen due to various kinds of brain diseases and issues. And specifically, one that comes to mind is frontotemporal lobar degeneration, or frontotemporal dementia with the behavioral variant. One of the initial symptoms can be that the person has some real significant changes in their behavior. They act impulsively, recklessly, and can do things that are devastating to themselves and their family. And they don't have any sense that these things are not appropriate, or even they may be doing illegal things, and this was never something that was in their life that they would have done. So this could all be due to the brain disease.